Welcome back. Let's take note of the HIV situation and the 2025 National HIV and AIDS Symposium. Now, the reality on ground is grim reading for anyone who wants to pay attention. There are so many interventions that are faltering on account of what happened in the aftermath of COVID. Critically needed funds and resources into the fight against HIV AIDS all of a sudden dried up, and that required a realigning of other sources of funding, especially from the government, in order to maintain interventions for those that are living with HIV AIDS. Now, the latest information is that if those gaps are not closed, we might not meet the targets that were set in the fight against HIV by the year 2030. At individual level, if nothing changes in how you conduct yourself, we might also not meet critical targets, and you and others might become an ugly statistic. But should you? Of course not. Joining us this morning for this conversation and insight into the achievements that have been made, but also the remaining gaps that need to be closed, is Dr. Daniel Byamukama, the head of HIV prevention at the Uganda AIDS Commission. You're most welcome to the program.
Thank you.
First things first, why should we take note?
Thank you. There are several reasons why we should take note. Number one, HIV remains a significant problem. It's a significant problem for an individual. It's a significant problem for the country. Specifically for the country, we spend so much money on the HIV response.
That is right.
The budget for the HIV response is equal to the budget of all the other diseases combined. The budget of fighting HIV is equal to the budget of the Ministry of Health without HIV. That is how big the amount of money we use to fight the HIV epidemic. And if the people continue contracting HIV, that budget can only keep on growing. And it's of concern that a significant part of our budget was coming from our donors. We see donors folding their mats now. They are leaving. That means the government must shoulder the burden of paying for the antiretroviral drugs, of paying for the condoms, or paying for pre-exposure programs, all the tools we use. That is of great consequence, because the government must draw money from other important programs to fund the HIV program. So people must, I like when you target on individuals, individuals must do what they need to do to make sure they don't add themselves on the already high number of people living with HIV. We estimate now the number has grown to slightly above 1.5 million. Majority of those are actually women. Women make around 930 of those 1.5 million. The rest are men and children below
930,000
of the 1.5 are actually women. So the rest are men and children. So the HIV epidemic, as it were, affects women disproportionately.
That is right.
And we'll need to explore how to empower the women to make sure actually we stop the disproportionate effect of HIV on women, but as we drive to the national goal of ending AIDS as a public health threat by 2030.
Okay, we shall be looking at why these disparities persist very shortly, but information on my table is that the national HIV prevalence has dropped by 4.9%, down from about 18 in the 1980s, and this is reflecting on the country's sustained commitment to prevention, treatment, as well as community engagement. When you talk about the fact that targets, including the 2030, might not be achieved on account of dwindling resources, what are these particular areas that we must not take the foot off the gas?
Yeah, thank you. You see, the target for 2030, to realize it, we need to implement the programs. So we have interventions and tools that we know can deliver the 2030 goal.
Yeah.
One of them, of course, is HIV treatment. we cannot afford to default on HIV treatment. Because people living with HIV, if they start missing their medication, their transmission of HIV increases. But we have prevention programs for those not living with HIV. Prevention programs like the condom program, like the abstinence and be faithful, community education and mobilization, like the circumcision program, and now the most recent promising is pre-exposure prophylaxis, which we have in the form of pills, the daily pill, and the injectable.
And the injectables,
If we were to reflect, most of that, including circumcision, the pre-exposure prophylaxis, was mainly supported by the donor. And all those combined, we are responsible for a reduction in the HIV prevalence and in the number of HIV, new HIV infections. So there is no single tool that can actually help us reduce the number of new HIV infections significantly. We need all the various tools, including those that were primarily supported by donors, the examples I've given. So it looks like we risk putting our foot off the pedal in some of those prevention interventions.
That's right.
But we cannot afford it, because that means we shall lose the fight. We shall lose the gains we had already made and the number of people contracting HIV. The next time I come here, if we don't make steps, if the leadership, the government does not make important decisions to fill the gap, the next time I come here, I think I will be reporting to you that the number of people living with HIV has increased, or the number of people dying from AIDS has increased. Last year we had 20,000 dying from AIDS. We had 37,000 contracting new HIV infections. It would be a shame if we report that that number has gone up. Yet, over time, we have consistently brought that number down.
It is by prayer that that remains a distant possibility. Now, on the disparities that persist, the reality on the ground might be misunderstood, especially by those who don't want to crunch the numbers. When you talk about the fact that women are the most significantly affected segment of the population, somebody might assume that they are largely responsible for either wayward behavior, they might not be consistent in prevention measures. What is the true picture like? Why is it that women are heavily affected?
Yeah, I think that is an important question that needs clarification. When we assess people's behavior, the behavior that put individuals at risk of contracting HIV, we do that regularly. We conduct national surveys. We realize that actually the behaviors of women and men that are risky, we consider risky, are equal. They are even.
That is right.
There is no gender that is more risky, that is more promiscuous than the other. That data we have. But of course, in some communities, you find people saying women are not promiscuous. It's the men who are promiscuous. That is not true. We are equally at risk. What puts women at risk is that for a long time, the HIV prevention tools that we have, they depend on the cooperation of the man. There was no HIV prevention tool that the woman was controlling. So every woman is at the mercy of the man. So if a man is not aware of the HIV status or thinks they have been risky, their incentive to use protection to save the woman is almost not there.
That is right.
So women have high HIV infections because of the man. The man who is not motivated because they don't have HIV to
ensure safety.
And the women are not empowered. They don't have tools under their control. But fortunately, we have invented new tools in the form of pre-exposure prophylaxis, specifically the injectable. We have invented a new injectable called the Nakapavir, which a person can take discreetly because the oral daily pill,
that fear of stigma that affects
the fear of stigma, the pill. So we expect that the injection can be discreet. It takes away the stigma. That women can sneak in the hospital who cannot get the cooperation of their spouses, and we give them the injection. 2 injections in a year. We believe it will revolutionize prevention for a woman. It will empower the woman to be in charge of their prevention plan. We expect to see that disproportionate effect on women to come down significantly.
But it's also true that the men have a lot more partners than women. it's more likely to find a man with 3 wives than a woman
yes, of course.
2 husbands.
Yes, of course. Yes.
So to speak.
Yes, of
I think that
course.
also explains why the numbers are what they are.
Yeah.
All right. Now, the Uganda AIDS Commission is organizing the 2025 National HIV and AIDS Symposium. How significant is this to the various response interventions that are rolling out? And what are the key themes and outcomes that we expect this drive to bring through?
Thank you. You see, the National HIV and AIDS Symposium, we are taking it to Mbarara.
Okay.
And it is one of the events that we have organized as we gear up for World AIDS Day, which is always in 1st December. World AIDS Day is going to be in Bushenyi. So the symposium is going to be in Imbara at Imbara University. And the reason we organize this symposium is threefold. Number one, every day our researchers are producing new products, new science on how we can fight HIV better. But the communities are not aware of these things.
That's right.
So we would want to move the community closer to the people so that they can get to interact with the researchers, they can get to interact with the service providers, so that they learn of the services that they are, so they can ask for these services. We have so many good services, but the communities are not aware. We have a commitment, for example, to end AIDS as a public health threat by 2030. It's a presidential fast-track initiative. If you went to the villages back there in Rwamabondo, people are not aware that the country has a commitment to end the epidemic, and we believe we have what it needs. So we want to move closer to the community so that we can disseminate this message. They can see the tools we have firsthand. They can engage with us. They can ask us the questions. They can ask the science the questions. But it's also an opportunity for our researchers to disseminate the science of how we are going to end, what are new tools coming up, of how we're going to end the epidemic. It's a shame that our researchers first announced their research in Geneva, in Atlanta. So we create an opportunity for researchers to disseminate to the population the new research findings. But also, like all other sectors, we conduct annual reviews to see how did we progress last year. The targets we set for the country and the effort we put in to realize those targets. Did it work as we anticipated? So it's a sector review where we present to stakeholders what we have achieved and we explain our failures. And together as a country, we make up our mind on how we shall progress to make sure we hit our targets for the next year.
Okay.
So it's an important event for the HIV response in the country. It re-energizes us. And of course, as I said, it leads us to the World AIDS Day, which will be presided over by His Excellency in Bushenyi. And whenever we choose where to host these events, it is for a reason.
It's for a reason.
So we see the Ankole region needs mobilization, needs education, because it's one of the regions with the highest prevalence. It's one of the regions with the high-risk population groups. The number of sex workers in Imbara keeps increasing every year. So we believe we should take our camp there, our campfire.
Dr. Byamukama, our very last question is, of course, on the impetus that you are giving the youth question and their involvement. Many will want to understand, how do they register for the conference, the symposium that is going to be held? Is it something they can register quickly online?
Yes, of course. They can register online, but they can walk in. They can simply walk in and be part. It's free. It's open. So open for everybody. They can walk in, and we specifically want the youth to be part of this occasion, because, as we often tell you, the greatest number of new HIV infections are occurring among the young people, most especially the young women, and we must work together, even them as key stakeholders, to end that disparity.
All right. Thank you very much, Dr. Daniel Byamukama, the head of HIV prevention at the Uganda AIDS Commission, for bringing us up to speed with what interventions are being rolled out, but most significantly about the fact that we have the ability to stay on track and ensure that some of these pitfalls that we might find ourselves in on account of dwindling resources are rectified. It's always a pleasure talking to you, and we wish you the very best, especially in the upcoming symposium in Mbarara. There you have it. Be part of that. You can walk in free. There is nothing that should hold you back. Now, let's go to Lira, where there is a battleground constituency, the one that has MPs, or rather ministers, I should be very specific, Dr. Jane Ruth Acheng and Betty Amogi, vying for the position of woman representative. It's one that is bringing out the best of the two, but some say the ugly is also rearing its head. We shall be bringing you that after the break. Stay with us.